One.
Welcome, everyone. Thank you for joining today's webinar. We will give it a minute to let everyone join. Good morning, everyone. My name is Kevin Olicle with National Partnership for New Americans, NPNA. NPNA is a national organization made up of 41 immigrant rights organizations across 37 states. Our members move local, state, and federal organizing and advocacy campaigns for immigrant rights while also providing essential services to communities. Over the past 7 months, NPNA members and the nonprofit organizations you will hear from today have been on the front lines of COVID-19 response efforts in immigrant and refugee communities. Our organizations quickly adapted to provide virtual or safe in-person essential community services, support families with relief funds for those excluded from the CARES Act, and have continued to organize locally and statewide for immigrant and refugee rights. NPNA has also been a lead partner with the Cook County Recovery Initiative, a rapid response initiative launched by Cook County Board President Tony Preckwinkle to provide loans, resources, and technical assistance to Cook County businesses, independent contractors, and nonprofit organizations. This webinar has been made possible by the Cook County Recovery Program. On today's webinar, we will hear how nonprofits from across Chicago communities have adapted their core services and programs, lessons they learned, and innovative strategies for programs and fundraising in the midst of the COVID-19 pandemic. Our speakers today will include Sochi Flores, Bureau Chief of Economic Development for Cook County, Illinois; Chirag Shah, Community Navigator, Program Manager at the Indo-American Center; Morley Patel, Associate Director for the Chinese Mutual Aid Association; Ignacio Medina, Community Engagement Specialist for Erie Neighborhood House; and Inhe Choi, Executive Director of the HANA Center. After hearing from our speakers, we will have a Q&A section. Please enter your questions into the question box throughout the presentations, and we will take them at the end. The presentation, recording, and resources from this webinar will be shared with all participants. And so to begin today's program, it is my pleasure to introduce Sochi Flores, Bureau Chief of Economic Development for Cook County, Illinois.
Thank you, Kevin, and good morning to everyone. My name is Sochi Flores, and as Kevin said, I head up the county's economic development efforts. I'd like to first start off by thanking the National Partnership for New Americans, the Indo-American Center, the HANA Center, the Erie Neighborhood House, and the Chinese Mutual Aid Association for their partnership on our efforts to support nonprofits and for helping to put together this robust webinar today. And I also want to thank everyone and welcome you to this webinar. Thank you for taking the time to join us this morning. I realize that everyone is inundated and has tons of things to do and ways to keep our organizations afloat. So I appreciate you guys taking the time to join us this morning. We realize how difficult these past 6 months have been for everyone, but nonprofits around the country and throughout Cook County, you are all operating on extremely thin financial margins and the COVID-19 pandemic has greatly intensified those pressures on your organizations. This is a time when your services and assistance is needed the most, so it's even more important that we partner to figure out how to assist you in getting through these times. Our Bureau, since March, has been working tirelessly to create programs to really help fill the gaps, to better support communities, municipalities, and small businesses, and try to keep everyone operational and resilient. This effort is called the Cook County Community Recovery Initiative. We quickly activated to create a national partnership and launch a series of technical assistance resources. And in addition to that, we created financial assistance programs. And yesterday, we actually closed out our $10,000 small business grant assistance program that we launched just recently. All of these programs are instrumental right now and are providing guidance and support services to our most vulnerable businesses and communities impacted by this pandemic. Our work is really centered around the idea that all businesses are essential to building a strong economy. Nonprofits are uniquely positioned because your work strengthens our communities, it connects people to crucial resources, programs, and cultural outlets. You are each vital to bringing balance, vibrancy, and economic development to the business ecosystem. So we really appreciate your organizations and the support that you bring to our economic development efforts. Despite the challenges we are all facing, we are forging ahead and using an equity model to guide our work to address the gaps in resources and services. Recognizing that we can't do it alone, these unprecedented times require strong partnerships, and we have been very active with partnering with others because we realize that it's critical that government entities, the private sector, and philanthropic organizations work together to create a pathway to recovery. In today's webinar, it's specifically focused for nonprofit services and program delivery and also fundraising strategies. But for me, it's about reinforcing our dedication and commitment to a community of organizations whose work is guided by vision and passion. We are acting quickly to make sure you're all well informed about the latest guidelines during the pandemic and want to make sure you understand how to put these guidelines to best use. We realize for many, navigating the maze of financial products, safety guidelines, and the latest information about the public health pandemic can be complicated, and Cook County and its partners are here to make it as easy as possible for you to abide by these guidelines. We realize this is no ordinary time. I can't say it enough, but nonprofits are the heart of municipalities and our communities throughout Cook County, and I want you to know that we are in this together. In the coming weeks, we will continue to launch new programs to help people stay in their homes, search for jobs, get financial assistance, and much more. So I encourage you and urge you to please continue listening to our webinars, but sign up for our newsletters. You can go to cookcountyil.gov/recovery so that you can get this information as soon as we launch these programs, because it's one thing to create the programs, and my team is rolling up our sleeves and trying to create as many programs as possible, but you guys play an important role in getting this information to the residents and our communities that need these resources. So I appreciate your partnership in getting this information out to our communities. Again, the website is cookcountyil.gov/recovery. So thank you. Please use this time to listen, ask questions, and let us know how we can help you. So thank you, and back to you, Kevin.
Thank you so much, Sochi, for all the work that you do for Cook County, and we will promise to continue to do our part to support the Cook County Recovery Initiative. Before we begin our speakers portion, we ask participants again to submit their questions for our presenters using the question box throughout the presentation. And now we will begin our speakers portion, and we will like to introduce Chirag Shah. Chirag is the Community Navigator Program Manager of the Indo-American Center.
Hey, Kevin. Thanks for having me here. So I think, in terms of strategies and plans for serving clients during a pandemic, I would say that it's kind of safe to say that most organizations that are here today or any other organizations did not have any strategies to serve clients during the pandemic or any other pandemic for that matter. So to explain how IAC has delivered services, I'm going to kind of explain the challenges and the solutions that we came up with during the lockdown and post-lockdown. So sometime in March, I think that's when the governor kind of made an announcement about the stay-at-home order, and that's when IAC officially closed their doors to see any clients in person, and all the staff were asked to work from home. So we weren't seeing any clients in person, and none of the staff were working in the building. So that was one of the biggest challenges that we had, was like, how are staff going to communicate with each other? Of course, we can say, yeah, we can always email each other and whatnot, but, we had the easiest way to communicate with another staff member in the building was just to go to their office and ask them a question and get an answer. So that was one of the biggest challenges that we had in the beginning. So to do that, of course, we created a WhatsApp group for all the staff to join. So, if someone had a question, they can just put it in the WhatsApp group, and the other staff member can answer it. And then, of course, we switched to staff meetings to Zoom and not in person. So those are the two ways that IAC solved their issues with staff communication. Then another challenge that we had was how we were going to reach our clients during the lockdown. Our clients like to come in person, and that is the best way to serve our clients. But of course, that was not possible during the lockdown. So to reach our clients, what we did was we pulled every single phone number from our database, which is about 2,500 phone numbers. And between the staff, volunteers, and community navigators, we called each client and conducted a wellness check on them. Basically asked them to see if they need anything, and connect those clients with the resources depending on what they needed. So a lot of clients said they needed access to food because during the lockdown, they weren't able to get to the grocery stores. Some clients had lost their jobs and wanted to apply for unemployment. Some clients wanted to apply for food stamps, Medicaid, and whatnot. And then a lot of clients had questions about language access. A lot of the information that was being pushed out by the state and the city was traditionally in English and Spanish, and many of our clients speak Hindi, Urdu, Arabic, Bangla, and other languages. So IAC created a zine basically to talk about all the things that related to COVID when it came to hand washing, social distancing, wearing a mask, and it also included some important guidelines and resources like applying for employment, applying for rental assistance, and other benefits that would be useful to those clients. If you go to the next slide, you can see the cover of that zine. So this zine was created and printed, and it was printed in 5 different languages: Hindi, Urdu, Arabic, Bangla, and I believe Gujarati. So the next challenge we had is this IAC has a Golden Diamonds program where the seniors come and enjoy the seniors program, and they also get a lunch during that seniors program. So of course, with the lockdown and no seniors coming in, how are we going to get meals to these seniors that relied on IAC for those meals, especially during lunch? So one of the solutions we had was to partner with the city of Chicago to deliver those meals to those seniors. But the problem with that is the seniors are used to or accustomed to certain foods, and the city was not able to provide those foods, typically like South Asian dishes and whatnot. So we were able to partner up with Catholic Charities, who basically funded us to purchase groceries that our seniors are culturally familiar with, and then we delivered those groceries to those seniors themselves. Another challenge was IAC has an ESL class as well as vision class, and so that was not going to happen anymore, of course, with the lockdown. So how are we going to still conduct our classes So one of the things that we did was we created small WhatsApp groups for each of the classes, and we moved towards a Zoom class. Now, of course, that still is a challenge today, is because not all our clients have the resources to access Zoom because they may not have internet at home, they might not have a computer, and some of them may have those things but just don't know how to use it. So we're not in full capacity yet with the amount of participation that goes on with our classes, but we're slowly getting there. So those were the challenges during the lockdown, is providing services, getting services to clients, communicating with clients, language access to classes, and providing food to the seniors. So during the lockdown, we kind of just, monitored with the governor's orders. We kind of monitored the cases in our area with COVID cases, how many were there and whatnot. And then I think sometime in June, we kind of opened our doors to seeing clients. So now I'm going to talk about what are the strategies that we use to open our doors safely to the community. So one of the first things we did was before we made an announcement to the public that IAC's doors were open to the public, we kind of had to set up our offices so that we can provide services in a safe manner. So one of the first things we did was between staff, we had a staggered schedule system. So basically not all staff members are coming on the same day, maybe every other day and whatnot. This is to minimize the number of people in the building. And we were only seeing clients by appointment as well. And this helped us kind of determine how many people were going to be in the building on a particular day. For any of the staff members that were going to be seeing clients face-to-face, we put sneeze guards in front of each of those staff members' desks. So there's a barrier between the client and the staff member. We placed hand sanitizers throughout the building. So when the client walks in, there's a hand sanitizer dispenser right there. They can clean their hands. We also placed posters outside the building and throughout the building, basically encouraging clients and staff to wear masks, social distance, that we were only seeing clients by appointment. And, we actually made a mask requirement, for anyone that came into the building. So, but the posters kind of helped remind that. And then after the lockdown, we started our seniors meal program, but we were not serving anyone on site. The cooks were coming in and cooking their meals, but we were delivering the meals to the seniors through hired drivers through IAC. In terms of the classes, we did kind of went into a hybrid model where some of the classes were happening via Zoom still, and some of the classes are now happening in person, but we're only limited to 2 to 3 people per class. And to prevent that, to make that sure that was safe, well, we took temperatures of each of the students when they came in and made sure they wear a mask. So to make sure our community was safe and fulfill the needs that the clients were needing, IAC has distributed over $377,000 to families in need, and this helped them pay rent, grocery bills, medical bills, and much more. And IAC has also distributed over 15,000 masks and hand sanitizers, and that was one of the biggest needs as well, is making sure people had masks and hand sanitizers when they were out and about and even coming to the center. In terms of fundraising, so usually around this time, IAC would be planning for their big annual gala. So of course that's not happening. So IAC has switched to mini small fundraisers via Zoom. We have 2 coming up. One is called Chai with Shaker, which is one of the participants on the Indian matchmaking show on November 15th. And we have another South Asian Spice Trail wine tasting event coming up on 10/25. And that's about it.
Thank you so much, Chirag, for sharing all the great work that you're doing with IAC. Next, we would like to introduce Morley Patel. Morley is the Associate Director of the Chinese Mutual Aid Association.
Great. Thank you, Kevin, for including me in this webcast. I'm honored to be in the company of such esteemed nonprofit leaders to hopefully help others in navigating this uncertain time. For those of you who may not be familiar with us, CMAA is a nonprofit organization serving the low-income pan-immigrant and refugee community throughout Chicagoland. We're located in the Uptown neighborhood on the north side of Chicago, and we also have a second location in Elgin, where we serve a lot of the Laotian population out there. And we serve this community through offering direct services. We've been around for nearly 40 years, and we offer everything from after-school and summer youth programming and mentorship programs for teens. We have workforce services, citizenship and immigration assistance, social services, which have been really important right now, such as Medicaid, food stamps, and we also do elder care services, which I will go into more detail on momentarily. Next slide, please. So our community care program is one of our biggest programs and has been vital during the shutdown. This is our program where we have over 200 home care aides who go into the homes of elderly and disabled clients and help them with daily tasks such as bathing or meal preparation or getting to doctor's appointments, things of this nature. This is an essential service. It is especially important for us to support this vulnerable population during this time, which also meant that while everybody else was staying home, our home care aides were braving the world, going out into people's homes on a daily basis to provide these services, which also helps maintain the health and well-being of this population. So initially, that was sort of our first conundrum, was how do we support all of these home care aides as they keep going out into the world? And so our first huge need was PPE, which was a challenge in the beginning. This wasn't something, it wasn't even a term we all knew of back then, right? And now it's become like commonplace. But we had this urgent need for face masks, of course, and more gloves and hand sanitizer, and we never really had ordered face masks or hand sanitizer at the time. We're lucky that places like organizations like MAHA stepped up and other organizations stepped up to help donate face masks during that time. And we also wanted to make sure we supported our home care aides in how they physically get to these clients, since a lot of them were scared to take public transportation at this time, which was totally fair. And we were lucky that one of our advisory council members, Dr. Karen Ang, actually helped link us up with Lyft, and we were able to get Lyft codes so that our home care aides had a safer way of maintaining these really important services. So that program has continued this entire time. We have not closed that service because it is considered an essential service by the state of Illinois. So as for our other services, we did have to initially, similar to Indo-American Center, close our physical office, and that was imperative for us to do right away, of course, due to the shutdown order, but also because we've been a community agency for nearly 40 years, as I'd mentioned earlier, and people congregate at CMAA in our lobby space. Even when we had the sign that we were closed, people were still knocking on the door, trying to get in, understandably, which is why we decided, we can't even be limited open for a while. We need to move everything onto virtual platforms or via phone. So also similar to IAC, we had a huge influx of need during this time. Most of our client population, because they are low-income immigrant refugees, that they are limited English speaking, most of them, unfortunately, were laid off. A lot of them work in the hospitality industry and or restaurant industry and or non-essential manufacturing, all of which is closed, and even today, as we know, have not fully come back. So the economic downturn has especially impacted our client population, unfortunately. So with this influx of need, we also similar to IAC, we started having our direct client staffers reach out to see if there were other needs that our clients might have. So phone calls were like how we first started in moving some of our services like social services, et cetera, into phone calls, and assessing like what needs were so that we could start opening up and looking into offering new services right now, right? We had to be adaptive. We had to, start creating things on the fly because as we all know, this is new to all of us and we have to suddenly navigate this new landscape. So along those lines, we then moved into Zoom platforms for our English as a second language classes, some of our workforce classes, et cetera, which was definitely a challenge because one, we have a limited English speaking population to begin with, and a lot of them are digitally not very literate. So we actually had a lot of our staff begin training clients on how to access Zoom, how to be in these classes so that we could continue these services. And that was quite a challenge. We have one ESL teacher in particular who spent 2 hours working with one of our clients to get her access to Zoom. But now that client can now access all of our services, which is actually we see as a great success story. So that's how we started moving some of our services onto virtual platforms. And one thing that was really great is because youth typically are more adept with technology, it was easier to move our teen mentorship programs into Zoom, and we also modified that programming to make sure that we are helping these teenagers with like mental health as well, making sure we were creating safe spaces for these kids, a lot of whom had parents who'd been laid off or had stores that had been looted in our neighborhood. So we made sure there was another way that we were trying to be adaptive to what our clients might need and trying to fill those needs to the best of our ability. Next, what we had to do then is through these intake phone calls and kind of assessing what people might need at this time, we launched new services. So we saw an influx, of course, of people who are suddenly applying for unemployment benefits. For those who speak English, that is a very difficult process as it is. For our clients, it was especially difficult. In the past, we would just physically send people to the unemployment office and that is an in-depth process. Obviously, we could no longer do that. And so one of our wonderful managers, youth department manager, Margaret Smith, actually took it upon herself to create a training for our staff so that we can start guiding people ourselves through the complicated process of applying for unemployment benefits. We also were very lucky to partner with the city of Chicago on offering rental assistance for all of these clients who were suddenly really hit hard by the economic downturn and were struggling with making rent payments. And we've partnered with the city of Chicago twice now. In total, we'll be giving away over $500,000 in rental assistance to families who need it, which is just really, really wonderful. We're so grateful to the city for recognizing this need and for choosing us to help find these clients. We also created our own internal cash assistance program from philanthropic support to help people with, it could use it for any immediate needs, including rent, but it could also be used for groceries if people need medical help or assistance with paying medical bills. So we've also created our own internal cash assistance program that just has wider parameters that can be used for not just rent. So that's another new need or new service that we are now providing. And we also created a COVID relief landing page on our website. What's great is that a lot of state agencies are now offering resources, but again, for our limited English-speaking client population, it's a lot of resources from a lot of different places, and there wasn't one web page or one place where people could go where all these resources are aggregated and also translated. So we spent a good amount of time on our website. So if you go to ChineseMutualAid.org, there's we have a link on there for COVID resources, and we basically included everything that we know to be available. So that includes like where you can get tested for COVID, internet resources for low-income people so that they can stay connected to what's happening right now, and of course also resources of how they can apply for the rental assistance, et cetera. So that was pretty much what we started like initially, was like, okay, you know, let's meet this need, let's move things to Zoom and or phone calls. And though it was a bit of a transition, I think we found our stride now at this point, which is really great. And our associate board also got involved with doing a technology drive, because not all of our clients have access to laptops or tablets. So that's something else that we've been working on ourselves. And we're lucky that the state has also given us some funding so that we can purchase for ESL programming, at least, technology that our clients can use during this time, and actually beyond as well. So moving into about July, August time, we normally have an in-person summer youth program, which I want to say around 200 students participate. And normally, you know, that's a very active in-person program. And so our youth program was really good at being versatile. And we did open that program, but on a very limited basis. We definitely took advantage of the fact that it was summer, and so we had as much programming as possible outside. We did, similar to IEC as well, we did the screenings, we did temperature checks, masks were required, so we were able to have limited in-person programming, and we shortened the length of the time as well for our summer camp, which was very successful. And now we are moving into having the office open by appointment only for clients. And we are making that very clear as well on our signage. We've also done a press release to explain that, you know, we're not going to be allowing people to congregate in our lobby like we have in the past, or wait altogether in one small area. So we have made masks mandatory as well. People have to call in advance, make an appointment. And then we have screening questions before the appointment to make sure that they haven't had any symptoms, they haven't been exposed to anybody. And then when they come, we also check their temperature, we have them sanitize their hands, and we have pods throughout the office so that people are socially distanced. And there's more than 6 feet in between where clients will be meeting with staff members. Lastly, we also have realized that this has been tough on our staff themselves, especially in the beginning. All of us, for the most part, were working far longer hours than normal to try to meet this client need. This pandemic is tough on all of us, and the quarantine is tough on all of us. And so our executive director, Dennis Mondero, created with a lot of like generosity and thoughtfulness around how to support our staff. We actually have instituted health and wellness days for our staff. So 1 day a month, staff can take time off. It doesn't affect their vacation time. It doesn't affect their personal time or anything. And they can just take that day to do like restful and restorative exercises, whatever that may be, whether it's physical exercise or meditation, just to take a day for themselves. Also knowing that working this much, we also want to keep our immunity up, right, and take care of ourselves. So that's something new that we've instituted, along with more regular staff meetings. So staff, I know I keep saying it, but just like IEC, staff has been, we've moved all of our meetings to Zoom. So we're seeing each other via Zoom platforms. But because we're no longer in person, obviously, you know, we're not seeing each other as much. And so we used to have monthly staff meetings. We've moved that to bi-monthly so that we can feel more connected to one another on a more regular basis. And we've instituted more like team building activities during that time, and doing like Zoom breakout rooms, and having, you know, picking topics and conversations, or like we played Pictionary recently, just things so that we can be taking care of ourselves more as we take care of our community. Yeah, I think we can go to the next slide, please.
Hi, Morley. Just wanted to
Oh,
let
sorry.
you know you're coming up on time.
Okay, I'll make this short, this next piece short. Thank you, Kevin. This last piece on fundraising, so initially we were concerned about how we were going to meet the needs of this community and have the correct amount of resources. We're very lucky that our philanthropic and corporate partners really stepped up their funding for our COVID relief efforts. And I think a lot of that had to do with our adapting our services to meet these new needs. Funders came to our aid, and we're really grateful for that. One special opportunity I'd like to highlight that exists now that I don't think existed quite as much previously is we're able to refocus on individual giving in a much stronger way. And I think the reason for that is actually Zoom has made it much easier for us to reach out to individuals. In the past, we try to meet for coffee or meet for lunch, and it had to be like, your schedule was clear, my schedule was clear. We could meet somewhere, it was just a lot more time and energy. Where now we can pretty easily talk to anyone via Zoom without a ton of planning ahead of time. So I feel like this has actually increased our ability to have regular touch points with individual giving, which is where I would encourage all of you to consider that, to consider refocusing on individual giving. Also, people have this need to take action right now. People are feeling that a lot is happening and there's some angst around that. And so this is a great time to kind of direct people on how they can make a difference. So we're doing more storytelling via email blasts. We're doing more Facebook posts. We're explaining clients who have been helped by these services, and we're getting higher open rates right now because people are stuck on their screens all day. So there are some benefits here that we can take advantage of. We actually have raised more than we expected because of this influx of giving that's happened, which is really exciting, and we're really proud of that. But we also need to keep in mind that right now we've been focusing on COVID relief, and we will at some point, and we're starting to do that now, move into COVID recovery. And the way we see that is we see potentially in the future, relatively soon, as the economy starts to improve towards as things calm down, that we will have a huge influx of people interested in our workforce services and needing to get back to work. And so we're making sure that we support that program, right, and look for funding opportunities for that program in particular. We've also moved our fundraisers onto virtual platforms similar to IAC, so we will be having our virtual annual dinner on November 12th, and we're highlighting our COVID relief programs as well as our community care program, which I had mentioned earlier. And we've also found more creative ways of engaging donors. So we had a West Side cleanup event in West Garfield Park. Basically what we're trying to do is we know people want to take action. And so this is a way for people to feel connected to a mission, feel like they're doing something, and then also be connected with CMAA and our mission. And I think the more you can get out what you're doing right now, I think the better chance you have of being able to connect with people's desires and needs to give back. And I think you'll be more successful in doing so.
Thank you, Morley.
That's pretty much it. Yeah, thank you, Kevin.
Thank you. No, thank you for sharing about the work that you're doing with CMA. Next, we have Ignacio Medina, Community Engagement Specialist from the Erie Neighborhood House.
Hi, good morning. Thank you, Kevin. Thanks for also giving us the opportunity to be part of this great panel. Erie Neighborhood House opened in 1870 in Chicago West Town neighborhood. As the city and community has changed over the century and a half, so we've been adapting to our immigrant community needs. We currently have 4 locations, 2 in West Town, 1 in Logan Square, and 1 in Little Village, where we actually provide services such as citizenship and immigration, community literacy, which actually has tutoring, pairing one-on-one with our clients, our participants, our early childhood education, ESL, ADE classes, our health and leadership program, which actually manage different initiatives like nutrition, like Know Your Rights. Also, we do help participants to apply for public benefits. Little Village Reads, who has like an after-school program for kids and Proyecto Cuídate, which is more on the mental health care, school age, workforce development, and youth options. Since March, we've been serving our community remotely, offering virtual programming like online ESL and citizenship classes and workshops such as, again, Know Your Rights, public benefits, public charge, nutrition, also offering full phone legal consultations and telehealth counseling and more. We, as everyone else here in the panel, we have to be creative and adapt to this new normal. So we, in our Health and Leadership Department, we do have a Community Navigator program. So basically, we have an army of, volunteers that actually went online. They have the proper training to make phone calls. We use our own internal, list to connect with people and assist them with, finding food pantries, also applying for unemployment through our public benefit programs that we have. That it's coordinated by Carmen Oliveros. So they've been helping our participants since we, started with this pandemic in applying for link card, medical card, unemployment, SSI. So all those vital, public benefits we've been able to serve our community. Also, informing our community about their rights through the Legal Protection Fund and Access to Justice Program, which is a community Navigator program. We have been able to, encourage our participants to learn and get informed about their rights. Also, we were very active with the census, informing and assisting our community to filling out the census, to the importance of being counted. Other programs that I've been doing virtually are, youth program and our after-school age program. The staff has been very active, also connecting our families with internet resources, having our, families connected to resume classes, virtual classes. So actually, we've been serving our community in different fronts. So working long hours as well as unemployed, but we're happy to serve and taking that at the end of the day as an accomplishment that we've been helping our community. So we've been able to safely reopen to our programs for children and youth. And as we navigate this new normal with guidelines in place based on recommendations from the Center for Disease and Control, CDC, Illinois Department of Public Health, and our funding partners, Erie can now safely resume limited in-person programming too. Erie will be reopening for staff and participants in Phase 5 approach to gradually safe get back to business as usual. During this phase, the reopening period, Erie Health has implemented policies, procedures, and guidelines for all staff and participants to follow. The guidelines are based on recommendations from the CDC and the IDPH. Capacity is limited to only essential staff and select participants during this reopening period to allow for as much of physical distancing as possible. Erie Health is also creating health checkpoints for all staff and participants before entering the buildings and providing PPE to staff and participants, increasing cleaning and sanitizing of spaces, displaying all guidelines are clear. And this designing dedicated isolation spaces to ensure safety. We all continue to do our part following, guidelines and taking basic steps like wearing masks, frequently wash our hands. We can also ensure families, our entire community will be safe and healthy. So this is in place again to our reopening. Next slide, please. In terms of our funding, we actually launched a community relief fund the last week of March to help with direct financial support for our participants to help with basic needs such as rent, groceries, bills, and childcare. So far, we have raised $160,000 and support 250 families and growing. We have increased communication with our donors through biweekly e-blasts, so people are up to date on what is taking at Erie House. This more frequently e-blasts allow us to ask donors to support with emergency supplies. We recently sent an e-blast about our reopening share with donors that our reopening requires more technology support to all children could be better connected with virtual learning. We ask that e-blast for financial donations and help increasing our technology support. Next slide, please. We have also increased and personalized our social media pages. We tell stories, offer resources, and general updates. Our annual dinner, which takes place every March, now will be virtually next year, and we have already begun communication and fundraising. We have also continued on ongoing strategies such as the year-end appeal, and also we recently had a virtual poker tournament as part of our annual fundraising event. So we continue also looking for the strategies in how to do fundraising. Also, I want to mention that with the partnership of Access to Justice, we were able to serve 50 families with one-time $500 for the rental assistance. And through ICER, we were able to serve over 100 families with a one-time $1,000 for rental assistance. Thank you.
Thank you, Ignacio, for your presentation. Next, we have, quickly before we move on to our last speaker, we will, after our next presenter, we will be going into our Q&A panel. So again, we ask viewers to submit their questions for the Q&A section using the question box through the webinar. And so next finally we have In-Hae Choi, Executive Director of the HANA Center and board member of NPNA.
Good morning, everyone. Thank you so much for this opportunity to share HANA Center and our work as a general and also during this COVID. And I guess the benefit of going is like there's something that that's really what HANA Center. Let's go quickly and ask questions here. HANA Center actually means one. We are a recently merged organization of two of this Korean American community organizations, Korean American Community Services, American Resources. So it's a way to bring everybody together, language, but also people. HANA Center is to empower Korean Americans, but also multi-ethnic immigrant communities through our service and organizing and advocacy organizations to advance human rights. So our community is, Korean Americans and multi-ethnic immigrants, and that we mean Latinx folks and Black and Arab folks who live around our in Chicago Logan Park, and also Prospect Heights, which is like north and northwest suburbs, so up there. We also have a multi-ethnic youth, a really great youth program. And so we serve about 15,000 community members a year. And it's still, mostly Korean Americans, about 12,000. So that gives you some idea. I'm just going to go through, Kevin, I'm going to trust you to just go through some of the slides really quickly to show you. We have Early Childhood Education Center. We provide healthcare, public health and health care. We also do citizenship programs like all of us here on the panel. We also have a really great cultural program, as you could see.
drumming, and we have a youth program here, and you get to see the multi-ethnicity of our young people. And as I said, what HANA Center does, I believe that's a little bit distinctive, is that we do service and organizing in this panel. And so we are very much, engaged in policy advocacy as well. So fair tax is something that HANA Center is doing with our civic engagement program. We have also been really working on healthcare, and so we've been meeting with legislators to, advocate about healthcare for all. And we just won the healthcare for low-income seniors 65 and above, including undocumented immigrants. So those are the kind of things that we do. And we do that by registering people to vote. And here is a picture of seniors that are celebrating their, becoming a new, people who voted. And we also really focus on working with broader community, particularly the Black community. And so you see a picture here, bridges, not wall, of our actually undocumented leaders there. And we also do programming with Black community in the new series Undocumented Black Network to talk about as immigrants and undocumented with Black community as well. So in terms of, emerging needs in COVID, a lot has already been said. So it's really the kind of the topic that I could lift up is really language access became a huge need, like translating everything, learning new programs as others have shared, and then translating them into our Korean language, because we're not the top 5 in Illinois where the government provides that, right? We had to do a lot of person-to-person, support. And one thing I want to say, and then, I think about 2 weeks right after the, within about 2 to 3 weeks after the shutdown, we got like about 400 cases about unemployment from Korean speakers who didn't know how to complete the unemployment form. So I know that's very common with all of us here on the panel, but like rest of the communities in Chicago where, whose English is not their first language, or in other, the top 5 languages that are provided. And so we not only had to translate and support one-on-one over the phone, sometimes in person, but also we had to produce like a very homemade YouTube channel about our unemployment, like walking through step by step what to do, because we didn't have the capacity to do that. So we're encouraging people to do as much as you can, and then we'll support you. And as we all know, unemployment claim is not just like a one-time thing; it has to be an ongoing. So that work and it was a new work for us. That was one thing we didn't do, but now it's really become a program, certainly during COVID. We also did, advocacy around making sure that there was a relief fund for undocumented, because as you all know, that the federal stimulus check excluded those folks. So we advocated at the City of Chicago, State of Illinois, and private foundations, and we also, fundraise at the grassroots level. And so far, even though we have other programs, we provided almost, $300,000 in cash assistance directly to about, over 300 families. And then I've already been shared in terms of organizationally, chronologically, we had to buy a bunch of laptops and, pads and all of that. But we also really focused on cybersecurity training around it. Because we were one of the press conferences we got Zoom bombed, right? It's a really horrible experience for some of you who might have had that. So we focused on cybersecurity training and to get that measured. As we have, you're only invited, that kind of stuff. And then as others have shared, we had to develop COVID protocols, which, none of us know what this is. Like it's staff that's working on it. It's kind of become our sort of in-house specialist. Also, as Morley especially lifted up, there was a lot of anxiety and stress among staff. So we have also been trying to figure out doing training, even about like de-escalation training, because mental health wellness, but also de-escalation training, because we had community members like calling, like their unemployment didn't go through or their renewal on their, benefits didn't go through, and they would call and just really, upset and yell and take it out on us. So it was really hard on the staff. So we did that. And we also, in addition to, PTOs and that type of stuff, we actually raised funds so that we could provide each staff like some basic, like mental health counseling. So like co-payment at least. So we provided that for those who opted to do that. And like everyone said, we moved programming to virtual for everything that can be done virtually easier. So like organizing and advocacy work, civic engagement, we are reaching out to 52,000 Korean and Asian American voters right now for fair tax, and that's all being done. It was going to be canvassing, but we're doing phone banking. You could do that over the phone or over Zoom, but also service programs. We're still, like as others have said, staggering, but also those we could do over the phone. We continue to do that. And so, but like others, we had to open up our center as well. Like Early Childhood Education Center had to go fully open. As that was an essential services mandated by the state and the city. And so we have that open, and then we have these programs, by appointment only. And then, for some of the safety measures, with all this new, only thing that, I don't think there's anything, but we really do, there's some specifics here, but, we have been very vigilant about making sure that we have sign in and out, so we have contact tracing, because we have had nobody in our staff, immediate staff, have been tested positive, but actually increasingly more and more staff members are coming in contact with people who are testing positive. And so, so we had to have a protocol around that, and making sure that everyone signs in and out at least, but increasing testing, or just making sure there's more communication. We all been doing a lot more communication internally and externally, as well, as everyone said. So I think that in terms of fundraising, as I shared that we've been doing a lot of advocacy. So government, we have relief funds for undocumented, the city and the state, and then private foundations, we've gotten general operating grants, capacity building, and also relief fund for undocumented and grassroots. So total, HANA Center so far has raised $1.1 million, and about 80% of that is from the state government and city, and then about 18% was from private foundations and 2% from grassroots. So it's all online, and I wanted to share the last picture just to show, as we all have been, this is, we're all in it together, and so we have to work together. So thank you so much.
Thank you so much, Inhe. We are a little short on time, but we are going to move into our Q&A section. Again, if you have questions, please feel free to submit them. But this first question, we'll just go to Inhe. How should nonprofits engaged in social policy and advocacy position themselves to raise funds during this public health crisis, which has seen most foundations stress more support for life-saving and safety net programs?
Yeah, that's a really good question. If you have, we've been, I think what we have been doing, we have been meeting with whoever is calling and asking all this, we need unemployment. And so that we actually contacted the IDHS and unemployment to say, we don't have anything in Korean. Do you guys have that? We need that. It's, our staff was just we're working around. There's some advocacy that way. I think the funding, it was really relationship with our foundations that we would call and then, government funding, we worked for the civil and we started council, the ICER, so we made sure that demanding relief funds for undocumented people was part of that platform, and participated in meetings with the DHS governor's office so that they provide meetings. So I think it's really about engaging, like listening to our community, and we also meet with them, especially like groups like youth and undocumented seniors. We come together with all the wellness checks, just like what IAC and other organizations do. And we bring with and that and just really being persistent and raising issues because they need to hear from us, right? So lead with that sort of empowered way to do that. Yeah, that's what I can say.
Thank you. We are, for the next question, this is for every one of our panelists, if they can speak to, what do you see as the biggest need for your nonprofit and communities in the coming months? So we can start with Ignacio.
Yeah, well, the biggest need is for us is definitely continue in engaging with the community, be empathetic with their needs. Also, some member of this great organization, us also taking care of us, but also continue fundraising, looks for ways to raise money to continue providing the services that our community needs. But I would say the biggest need is to not to lose connection with our community and their needs, and also be resilient. We've been in the community for 150 years, and we plan to continue another 150 years. So hopefully we continue also connection with other non-for-profit organizations in this difficult time.
Thank you. Chirag, do you think you could quickly speak to what the biggest need for your nonprofit and communities might be in the next coming month?
Yeah, so I would say the biggest need for our organization is increased funding, I would say. We're not sure how these smaller Zoom fundraisers are going to pan out compared to our larger gala that we do around this time. For the community, I would say it's increased language access. It's one of the biggest challenges that we have. We don't have the resources to have every document that comes in from other orgs or the city or the state and have it translated in languages that our clients are fluent in. So, for us, it's a scramble to get the information out there in the best way that clients can understand. So we have to either hire a translator or have someone in-house translate it, and maybe we just don't have the time or the resources to do that in-house. So sometimes getting the information out in the languages that the clients are fluent in, language access in terms of GOTV stuff, census, COVID stuff, I would say that's the biggest need that we have for the community right now.
Thank you. Morley, do you think you could quickly speak to what you think the biggest need for your nonprofit and communities are for the next coming months?
Sure, absolutely. I think one concern that we have is COVID fatigue. We had a huge influx of relief resources initially. And similar to what my co-panelists have said, really, we also need language access, but we also need to make sure that our clients keep having access to PPE. That we keep having technology needs met, but there's more internet resources and free internet resources available to this community, but also that people stay engaged with what's happening with these low-income communities, especially communities of color and immigrant communities, and that this stays relevant, people stay connected, as Ignacio had also said, and that, funding continues. And people recognize that though COVID has come, it's still with us, and we also will need continued support and funding as we move into the recovery phase.
Thank you. Inhe, would you be able to quickly speak to that as well?
Really, everything people have said, we totally agree. But one quick thing I just want to say is that in terms of foundations and states, there has been a lot of COVID-specific and relief funds, but also, like, I don't know then how they're going to focus for, like, general operating and other programs. That's something that I believe as a field they need to think about, and it would be good for us to be engaged. So this is all to say that at the systemic level, we need that stimulus fund. And the Congress has to pass that act so that we get that. That is going to depend on our state for us to be able to get funding, not only the COVID-related, but all the programming that we've already been doing, because we're really worried about what's going to happen in January, right? And then just quickly for a state, I think that for us, the need is to really, the solution is got to pass the fair tax. Fair tax can be one systemic issue to generate additional funding for human and what our organizations are doing. Dual level organizations need to go out and one to vote. I mean, a lot of new Americans and community navigators. This has to be one of the things we really emphasize and win the tax, at least in Illinois. Thank you much.
Thank you so much. We are a little over our 11 a.m. Ending time, and so we want to close out our webinar today. Thank you to our panelists for taking the time to answer these important questions. We want to reiterate our commitment and that of all our partner organizations to continue supporting nonprofits during this time. NPNA will continue to work within the Cook County Recovery Initiative to curate resources and webinars that address nonprofits' most pressing needs. To help us do this, please feel free to send us suggestions for subject matters that you would like to see covered in the future. The presentation, recording, and resources from this webinar will be shared with all participants. Thank you again to all the presenters and partners, and we hope everyone has a good day.
Thank you.
Thank you so much.
Thank you.